A live news conference with the group that is the Registered Nurses Association of Ontario. Let's listen in.
Across Turtle Island. By making this land acknowledgement, we are taking part in an act of reconciliation, honoring the land and Indigenous heritage, which dates back over 10,000 years. Now it is my pleasure to introduce Dr. Claudette Holloway, President of RNAO.
Thank you, Morgan, and good morning, everyone. As our immediate past president just noted, this is a special day for our association. This is our 23rd annual Queen's Park Day, a day that nursing leaders, 150 of them, come to the legislature to meet with our elected representatives to discuss the issues facing the profession, our health system, and the health of Ontarians. We take this responsibility seriously because our role is to serve the public, and our goal is to keep people healthy and care for them when ill. This morning, we are releasing our Nursing Career Pathways report. It examines the nursing landscape, its opportunities, and how we can strengthen and rebuild our profession so nurses can fulfill their aspirations and be fully equipped to provide the care Ontarians need during all ages and stages of life. Nursing is a profession that has the power to inspire, attract and fulfill people who choose to care for others. It's rewarding and full of possibilities. Nurses have extensive academic preparation and draw on the education and experience they gain in their roles throughout their career. Nurses often refer to their career as being a journey of lifelong learning. Our report celebrates all nurses. It also showcases the career pathways, the diverse and rich variety of journeys that are available to registered practical nurses, registered nurses, and nurse practitioners who want to explore additional education opportunities or want to attain a specialty. You can read in the report the amazing profiles of nurses, including students who share this journey. I would like to take a moment to reflect on my own nursing career, one that has been rich and varied. I have been an RN for 52 years, 48 years in Canada. I am an internationally educated nurse, beginning my career in England. I have a baccalaureate degree, a master's degree, and a doctorate degree. I have worked in public health, hospitals, home care, long-term care. I've provided bedside care and worked as a manager, director, education. I also had the privilege to lead programs in planning and policy. There is a direct relationship between a healthy nursing workforce and a healthy population. A strong and vibrant nursing profession is necessary for a well-functioning health system and people's overall health. Nursing is a demanding, amazing, and exhilarating profession. Given the central role nurses play throughout our healthcare system, nurses must experience respect for their roles and for the profession itself. Respect for our levels of education, our skill sets, and the various roles and specialities in which we work across sectors of our healthcare system. Our roles and careers take us to a variety of domains of practice, such as clinical practice, administration, education, research, and policy. Nursing practice is evidence-based and informed by a deep understanding of the social and environmental determinants of health that shape people's lives. The latter is why nurses are such passionate advocates for healthy public policy. This exquisite combination of evidence-based clinical expertise and social environmental determinants of health are essential to improve health and system outcomes at the population level. Yet, nurses have not felt respected, not in the way we should, given our central role in the system. The past 3 years have exposed vulnerabilities as an already understaffed nursing workforce slipped into a deeper crisis. A comprehensive survey RNAO released less than a year ago revealed that 75% of nurses were burnt out, and 69% of the more than 5,000 nurses surveyed said that they plan to leave the profession within 5 years. This is disastrous for our health system and for Ontarians. There is such huge potential and so much we can do better. We must unleash the unlimited potential that exists within nursing and expose high school students and second career seekers to the enormous opportunities. At the same time, we must tackle the barriers so that we can chart a new course for our profession. That course is laid out in our report. Thank you.
Thank you, Claudette. Now I welcome Dr. Doris Grinspan, RNAO's CEO, to share the recommendations in our report.
Thank you, Morgan. Good morning, everyone. The state of nursing, as our amazing president, Dr. Claudette Holloway, just shared, must be viewed in the context of two themes: opportunities and barriers. This report is a window for high school students and those considering a second career to choose from the world of opportunities nursing offers. The report also serves as a source of pride and hope to nursing colleagues already working in our health system. Lastly, it is a call to action for politicians and for employers, so that together we overcome the barriers and create new opportunities that take nurses and the nursing profession to new heights, not for nursing, but for the sake of Ontarians. I have been an RN for almost 48 years, 34 of those in Canada. I have worked as a staff nurse, clinical nurse specialist, manager, director of nursing, and as an executive, as a researcher, and as a policymaker. I began my career after earning an RN diploma. I obtained my baccalaureate degree and then a Master's of Nursing Science, as well as a PhD. I am also an internationally educated nurse, or what, as of late, the media refers IENs. I have been privileged to work in several countries throughout my career. Like my colleague, I am in debt to the awesome profession that I entered years ago that has opened a world of opportunities and possibilities for me. This is why I present our recommendations to you with passion and with determination. These are evidence-based recommendations. We know that if they are implemented, nurses will be able to continue fulfilling their vital roles. The health and the well-being of Ontarians is at stake. We face huge challenges in Ontario, but none that cannot be overcome. We entered the pandemic with a shortfall of 22,000 RNs on a per capita basis compared to the rest of Canada. Let me repeat, we entered the pandemic with 22,000 shortfall RNs. The shortfall not only has stayed like that, but has grown, and we now need 24,000 RNs to bring Ontario in line with the rest of the country. We have seen an increase in RNs and RPN vacancies and what we call stubborn vacancies. They have doubled since the start of the pandemic, both for RNs and for RPNs. The crisis in nursing is real, is tragic, and we all pay dearly for it with our health. Both nurses pay with their health and Ontarians pay with their health when ERs are closed, ICUs get closed, weekends, etc. We will pay even more if we don't address it. Let us be clear. For-profit, standalone clinics on the side will not solve the situation of Ontarians. Solving the nursing crisis and bringing all those surgeries in opening the ORs in our hospitals on weekends and on evenings, that will solve the crisis. If we don't address it, that crisis will result and more system failure, because it is about system failure, to recognize the centrality of nurses' work and their fundamental role in our system. Rather than blaming and shaming, we all must get our act together and fix the nursing crisis once and for all. RNO has laid a path in a sequence of hard-hitting reports. Today, we unveil the latest one. It highlights the imperative to build nursing careers in Ontario through retention and recruitment by implementing the recommendations laid out in the report, Nursing Career Pathways. If we open these possibilities that my colleague and I were so lucky to have, if we make those possibilities certain, nurses will want both to enter the profession and to stay in the profession right here at home. It starts with compensation. Shockingly, the real income of nurses in Ontario has been declining since 2010. The fall in real income has sharpened with high inflation and the government's wage restraint, Bill 124. We have been talking about Bill 124 since its inception. It never should have existed, and it never should have been challenged in the court when actually the court deemed it unconstitutional. It's now the time to tell nurses that you will earn, after inflation, less and less and less each passing year. Do you think that after all that nurses gave during the pandemic and that they're exiting the profession in droves, do you think that now is the time to tell them that they will earn less and less and less? This is a major barrier to retain nurses in the profession. Nurses feel devalued, and professionals, despite their education and skill set. Inadequate compensation doesn't just affect individual nurses. Whole sectors of practice, such as primary care, home care, and long-term care, are even more so affected. So retention and recruitment becomes immensely challenging. Nurses need and deserve adequate compensation and wage parity across all sectors of the health system. Let me repeat, a nurse that works in primary care should not be making less than a nurse that works in home care or in long-term care and in hospitals. We need to increase compensation for Ontario nurses in all roles, domains, and sectors, so it is competitive with compensation in other jurisdictions, including in the US. Address pay disparities among nurses working in different sectors, including home care and long-term care and primary care, by harmonizing their compensation upwards. Throughout the pandemic, nurses have worked with little rest, experienced tremendous levels of exhaustion, stress, and burnout, and suffered moral distress for not being able to provide safe and dignified care. No nurse wants to come to work to not deliver the best possible care, and many times that is happening. No surprise, the exodus from the profession and the shortage grows as a result. Nurses tell us we need better workplace supports and we need safe workloads. These are crucial retention factors. These barriers must be fixed, and we must ensure safe and healthy workplaces for nurses by increasing nurse staffing and support across all sectors. Implement evidence-based recommendations to retain and recruit nurses by providing full-time employment, mentorship and professional development, occupational health and safety measures, and enforcement, as well as safe workloads. I repeat, safe workloads. This is not only for nurses. Yes, it affects nursing satisfaction. More importantly, it affects patient outcomes. Our 2022 Nursing Through Crisis survey identified that 1/4 of all nurses believe better mentorship would keep them from leaving the profession. Mentorship is crucial to retention and absolutely essential for novice nurses and those taking on new roles. It also instills confidence. We have an opportunity, and that's why the government should expand the Nursing Graduate Guarantee, or NGG, to include all new nursing registrants in Ontario, including internationally educated nurses. We also urge the government to reinstate the Late Career Nurse Initiative, or LCNI, and encourage recently retired nurses to return as mentors for new graduates. This will relieve the pressure on the nurses at work, and this will bring a whole cadre of retired nurses back into the profession and into the workforce. That same survey also identified a need for nurse managers to be visible and accessible in their workplaces. This is an opportunity to support managers so they can better lead the nursing colleagues. RNO created and held free of charge our first leadership and management program last fall, and more offerings will be available this winter. That experience tells us that we need to provide nurse leaders with leadership training and supports. Not everybody is born a leader, and there are special issues depending on the sector that nurse managers need to know and that can be mentored for. Meaningful career development opportunities for nurses exist. The government should take advantage of the knowledge, skills, and potential of RNs and nurse practitioners so they can do more. We can start immediately if we expand RN scope of practice to include RN prescribing. Let me repeat it, expand RN scope of practice to include RN prescribing. It has been in the book since 2012. Do you think that 13 years is not enough to move with that? It was approved, it's still sitting on the table, it needs to move, not only for nurses, but for Ontarians. Expand NP scope of practice and innovative models of care, including more NP-led clinics. There are NP clinics, colleagues right here that I would like the media to interview, ready to open nurse practitioner clinics, waiting for over a year, and we say that people don't have access to primary care. Something is wrong with the picture. Continuing education also leads to career satisfaction and nurse satisfaction. And so we must increase funding and resources to nurses to pursue continuing education, professional development opportunities, and nursing specialty certification. Provide nurses with time off, flexible work scheduling, and compensation when pursuing continuing education. This is not only good for nurses, this is good for Ontarians. More education means better health. We face a critical shortage of nurses, and yet, shockingly, there are thousands of internationally educated nurses, like one time Claudette was and me, living in Ontario, ready to practice in this province, who still cannot do so. We are encouraged by recent actions of the government and the College of Nurses of Ontario. According to the latest data, 5,000 new IENs registrants have been registered with the CNO over the past 12 months. That is progress. While this is really fantastic, there are 6,000 IENs still in the application queue, and this is why we need to continue to implement policies and programs to ensure IENs who reside in Canada. We do not want to poach from countries that have even less resources than Canada and want to practice in Ontario, that they register and fast-track the registration with the College of Nurses of Ontario. Since health human resource planning is essential, the number of seats in nursing schools must continue to increase. We applaud the action the government has taken on this, yet more is required. There is heightened interest in nursing education amongst young people, and we expect that with our report there will be even more heightened interest and more applications. There is no shortage of applicants to the baccalaureate program for RNs, and so the increase in seats not only needs to be applauded, it needs to continue and increase further. We have 24,000 shortfall compared to the rest of the country. Let me repeat, every single effort needs to continue and increase, and new efforts need to be put in place. Increase the supply of RNs by further increasing enrollment and funding for four-year baccalaureate nursing program, second entry compressed program for RPNs moving to RNs. We have colleagues here also.
Okay, we've been listening in live to the CEO of the Registered Nurses Association of Ontario. They're releasing a report today on their priority issues, as well as the nursing crisis, which Doris Greenspun, the CEO, says is at a crisis. And it's a real tragic because they feel devalued and that all the people of Ontario will pay for it. She says that for-profit standalone clinics will not solve the healthcare crisis. Bringing in more nurses will.